Hello guys. So we have got a 40-year-old female who came to us with complaints of swelling and pain in her knee. So I want to point out how to look for synovitis and when to suspect inflammatory arthritis in a patient who comes with complaints of knee swelling. So the typical age of inflammatory arthritis to represent itself is around 30 to 40 years of age. And most commonly it affects females. So here we have got gross fluid in the knee joint. There is this significant effusion with synovial thickening, and we are seeing this proliferation of the synovium on the PDFS images, and we also see that there are some degenerative changes along with it. So the best sequence which will help us know what kind of synovitis is or where the synovial thickening is most prominent is that on the T2 weighted images. So in T2 weighted images, we are seeing this proliferative type of synovial effusion. So this is a frond-like synovial thickening along the suprapatellar pouch and in the suprapatellar fat pad as well. Here we are seeing in the posterior knee joint space or the posterior capsule, we also see this synovial lining. And as we move in the intercondylar region, so this is the ACL, and we are also seeing that surrounding the ACL we have got this frond like thickening of the synovium, and in the prefemoral fat pad and in the Hoffa's fat pad as well we have got this synovial thickening, significant synovial thickening which is evident, and we see that fluid is going within the popliteal recess, and this recess itself shows synovium, thickened synovium with it. So this is the case when we should suspect a primary synovitis. Secondary synovitis occurs whenever there are severe degenerative changes. For example, the patient might have undergone a radial tear of the meniscus, there might have been severe mucoid degeneration of the ACL, and in such cases when this goes on for a long period of time, then we should suspect that there is some kind of secondary or reactive synovitis which has started to occur. But when we see that the amount of fluid, joint fluid, is way more than what the degenerative changes should be associated with, and there is significant synovial thickening, we should definitely think of primary inflammatory pathology. And also we have got some few lymph nodes. If the amount of lymph nodes was more, or if the amount of periarticular soft tissue edema was more, then we should have thought that this is a kind of septic arthritis rather than being an inflammatory arthritis. Thank you.